you about common lower extremity problems that we see in our athletes. Some of the two most common things that we see are hip pain and ankle pain. Some of the common causes for this is overuse. With overuse, oftentimes comes improper training if you're not doing a proper warm-up before you go out and play your sport, and if you're not stretching afterwards, that's definitely going to play a big role and can definitely put you at risk for injury. Another thing that is a common cause is increasing your intensity too much too soon, too quickly. Especially in the fall or in the spring, you've had a little bit of a break from school, you might not be as active during your off times before your season starts up, and then you just go at it full speed, and that's definitely going to put you at risk for more injury. Another one is not doing enough targeted strengthening. Really honing in on those stabilizing muscles in your hips and also your lower legs and your ankles is definitely going to put you at risk for hip pain or ankle pain, even an ankle sprain, or more injuries in through your hips, and it can go all the way down the chain and affect your knees as well. Muscle imbalances, if you have certain muscles that are tighter, that aren't really activating the way that they should, or weakened muscles that aren't being strengthened is definitely going to be a common cause for hip pain and ankle pain. Some of the symptoms that you might see with this: pain in your hips when you're running. Sometimes you can even get pain getting in and out of the car, going up and down steps. If you're having ankle pain, going up and down steps can definitely be an aggravated problem. Getting up from a chair. If you're sitting in class, getting up from a chair, if you're sitting for a prolonged amount of time and then you go to stand up, all of a sudden it's like, ooh, that doesn't feel so great. Some other things you might have problems with: running, changing direction. Those pivoting motions can definitely put some torque in through your ankles and your hips as well. If this problem is not addressed and it's not handled, it can definitely cause further issues down the road. If you're having any kind of hip pain or ankle pain, you definitely want to get that addressed. It can lead to a muscle strain over time. That can definitely put you at a greater risk for a ligament strain or a tendon strain too, and over time that could lead to a tear. That's definitely something that you don't want, because that could lead you to surgery down the road, and then you will be out of your sport for a longer period of time. Some very common things that we do see with our athletes: hips specifically, labral tears, which is tearing of the supporting structures in your hip. And in ankles, we see a lot of ankle sprains, and over time, if you're not addressing the ankle sprains and coming in to really strengthen those muscles that aren't strong enough, that can lead to stress fractures over time, can also lead to ligament tears, and then you'll be out of your sport for a longer period of time. So one thing that I definitely wanted to talk to you guys about is how PT can help with all of this. If you come in, we will get you a diagnosis and really get to the root cause of the problem, really hone in on what it is that's causing your pain, and then we'll address it. We'll do some targeted strengthening, really hone in on those muscle imbalances that you have, and we'll also restore your range of motion. If there's any problems with the joints not moving the way that they should, we'll get those moving again. And then we have a return to sport program as well, so we'll really get you in on your sport-specific activities and make sure that you can get back on the field. I want to show you guys a quick self-assessment that you can do at home to test for hip pain, hip instability, and also ankle pain and ankle instability. This one is called the 1/3 knee bend test. So what you're going to do is get your balance on one foot. If you need to for balance, you can also hold on to something. And then you're going to do a single leg squat, but you're only going to come down about 1/3 of your total range of motion. So what you're looking for there is making sure that you're sitting back into it. You also want to look at your knee and your hip alignment with your ankle. If you are coming down and your knee has a tendency to come inward this way, that is something called valgus, and what that means is that you have some instability in your hip muscles and some weakness in your hip, which is causing your knee to bow inward. And then if you want to look down at my ankle, you can see my ankle's moving back and forth from side to side. which means I have a little bit of instability in my ankle. So if I'm playing a sport or doing something higher level like running, that's definitely going to put me at risk for injury. Another self-assessment that you can do at home is a modified version of the 1/3 knee bend test. So putting a chair behind you, getting your balance on one foot, and slowly lowering yourself into the chair. What you want to look for is, can you control it into the chair, or are you off balance? Do you just flop right down into the chair really quickly? Or do you have control, and can you keep everything from your hip to your knee to your ankle all in alignment as you lower yourself down? If you can't, and you're lowering and you're wobbling all over the place, you have some instability in your hip, also in your ankle, so all the way down the chain, you have muscle imbalances, some weaknesses that definitely need to be addressed. If you don't address these issues, if your knee is kind of all over the place, wobbling around when you're doing this test, that's going to put you at a greater risk for an ACL injury. The reason for that, if you have a tendency, if you're running or if your sport involves jumping, when you lift off and land, if you're in this position, it's going to put more stress on those ligaments and can definitely put you at a greater risk for tearing those ligaments. If you're an athlete and you're experiencing hip pain or ankle pain, or if you know an athlete who is experiencing these injuries, please call our office at 703-450-4300 and we can get you set up with an evaluation, or you can click the link below.